Welcome to Atlantic Cape Community College's Exposure Control Plan and Bloodborne Pathogen Training. This course is meant to complement the Safe College's Bloodborne Pathogen Training course. If you have not taken that course yet, please close this one and complete the Bloodborne Pathogen Training course first. Thank you. What is an exposure incident? OSHA's Bloodborne Pathogens Standard defines an exposure incident as specific contact with blood or other potentially infectious material, or OPIM, to the eye, mouth, other mucous membranes, broken skin, somewhere else on the body, such as through an injection with a contaminated hypodermic needle or getting cut by contaminated broken glass that occurs at the performance of a worker's duty. The New Jersey Public Employees Occupational Safety and Health Act, or POSHA, has adopted the OSHA Bloodborne Pathogens Standard to protect New Jersey public workers from becoming ill due to an exposure to bloodborne pathogens. Employers must perform an employee exposure evaluation and develop and implement an exposure control plan, or ECP, to keep safe those employees, which includes full and part-time employees and student workers, whose duties make it more likely that they may be exposed to blood or OPIM. Atlantic Cape has determined that your job duties make it more likely that you may be exposed to blood or OPIM. At the Atlantic Cape campuses, it is most likely that staff may encounter blood, vomit, excrement, or sewage that could result in an exposure incident. Atlantic Cape's exposure control plan includes 3 ways to avoid exposure: universal precautions, engineering controls and work practice controls, and personal protective equipment. First, we'll talk about universal precautions. All personnel must utilize universal precautions. Universal precautions are infection control methods that require employees to assume that all human blood and specified body fluids, and possibly animal blood or body fluids, are infectious for HIV, HBV, and other bloodborne pathogens and must be treated accordingly. The Safe College's Bloodborne Pathogen Training discusses specific universal precautions. Engineering controls and work practice controls are used to prevent exposure to bloodborne pathogens. Atlantic Cape uses the following: clearly labeled leak-proof biohazard bags or rigid containers to contain blood or OPIM and clearly denote the container's contents. Puncture-resistant disposal containers for sharp objects, needles, syringes, blood-contaminated glass, etc. Puncture-resistant lab glass boxes located in the laboratory areas for non-contaminated broken laboratory glass to avoid injuries. Biohazard and sharps containers are located in the following areas: in Mays Landing, in room E106, the compliance office; at Worthington Atlantic City, in the HPI equipment room; and in the Cape May campus, the housekeeping storage room. Readily available hand washing stations are provided in many areas, or when not available, antiseptic wipes or waterless hand sanitizers are also available and should be utilized. Employees must wash their hands as soon as possible after removing gloves or after unprotected or ungloved contact with blood or OPIM. Personnel should examine any equipment that may be contaminated with blood or OPIM prior to servicing or shipment and decontaminate any equipment as necessary. Equipment must be labeled if not completely decontaminated, and a prominent label or sign indicating that the item was not adequately decontaminated must be affixed to it. Personal protective equipment, such as disposable gloves, must be worn whenever it is reasonably anticipated that employees may have contact with or exposure to blood, feces, urine, or OPIM, such as when cleaning up blood or when conducting routine bathroom cleaning. Face shields or safety goggles with surgical or dust masks must be worn when splashes, sprays, spatters, or droplets of blood, urine, sweat, or any OPIM pose a hazard to the face, eyes, nose, or mouth. Tongs should be used to pick up all broken glass to avoid cuts and injuries. All PPE will be readily available from your supervisor at the beginning of each shift in sufficient quantities to last throughout the workday. Unless properly trained and authorized, no one should attempt blood or OPIM cleanup or first aid. If an incident occurs, immediately notify your supervisor and security. Contaminated PPE must be placed inside biohazard bags or containers and disposed of through the compliance office or lab or campus area with biohazard disposal. Wear appropriate PPE when it is anticipated that contact with OPIM may occur and when handling or touching contaminated items or surfaces. Replace any non-disposable PPE that may become torn, punctured, contaminated frequently, or if it can no longer function as a barrier. Biohazard bags and labels will be available in each department where regulated medical waste materials may be generated. Bags can also be obtained from the compliance officer. Never wash or decontaminate disposable gloves or other disposable PPE for reuse. If blood or OPIM penetrates a garment, the garments must be removed immediately or as soon as feasible. Pullover type garments must be cut off to avoid contamination of the face. The Hepatitis B vaccination series is available through Atlantic Cape's Occupational Health Services at no cost to any employee identified in the ECP whose job duties make it reasonably anticipated that they could be exposed to blood or OPIM. Receiving the vaccine is purely voluntary and is encouraged. An employee does not need the vaccine if that employee has previously received the series, proof is requested, antibody testing reveals that the employee is immune, medical reasons exist that prevent the employee from taking the vaccination, or the employee chooses not to participate. All eligible employees are encouraged to receive the HBV vaccination series. However, if an individual chooses to decline the HBV vaccination, then that individual must sign a documentation of refusal that will be kept with all records in the compliance office. If an employee covered by the BBP standard declines the HBV vaccination, but later wishes to receive it, it will be provided to them. Who is allowed to provide first aid on the Atlantic Cape campuses? Security personnel are designated first aid providers and first responders. Athletic trainers, coaches, and staff are designated first aid providers. The above listed job categories must receive pre-exposure training and have been offered HBV vaccinations. In the event of an exposure incident, they will advise security, HR, the compliance officer, and department head. The compliance officer and supervisor will ensure that all first aid providers receive training and specifics on how to report an exposure incident. If no pre-exposure vaccination has been given, HR and the compliance officer will ensure that all post-exposure medical tests, and post-exposure prophylaxis are offered per the standard. All other job categories will immediately notify security in the event first aid is required for any employees or students. However, in the event of a life-threatening injury, notify 911, then security. Good Samaritan acts that are not related to your job duties, which result in exposure to blood or OPIM from assisting a fellow employee, are not included in the bloodborne pathogen standard. However, POSHA encourages employers to offer post-exposure evaluation and follow-up in such cases. All such exposures must be immediately reported to security, the compliance officer, and human resources. Should an exposure incident occur, the employee should contact his or her immediate supervisor as soon as possible. The supervisor will contact security, human resources, and the compliance officer. Each exposure must be documented by the employee on an exposure incident report, which will be provided by the compliance officer. If possible, the offending material should be saved in the event testing is deemed appropriate. Employees are encouraged to immediately report to the nearest hospital, emergency center, urgent care center, or as directed by HR or security for a confidential medical evaluation and follow-up. It is important to understand if an exposure is a defined exposure incident under the BBP standard and for employees to understand their rights under that standard. If an exposure is covered under the BBP standard, then your employer is required to provide post-exposure evaluations by medical professionals and follow-up medical treatment as appropriate. The emergency medical provider is to be advised that the patient is an employee of Atlantic Cape Community College and that the exposure is a work-related incident. A post-exposure evaluation will be conducted by a medical professional and may include blood tests on the source individual and the exposed individual if consent is granted. After the post-exposure evaluation is completed and when medically indicated, post-exposure treatment will be as recommended by the U.S. Public Health Service and may include the following: counseling, evaluation of any reported illnesses, and medical treatment. It's important to note what is not an exposure as defined under the BBP standard. Again, OSHA's bloodborne pathogen standard defines an exposure incident as specific contact with blood or OPIM to the eye, mouth, other mucous membranes, broken skin, or somewhere other than these body parts, such as through an injection with a hypodermic needle or getting cut by contaminated broken glass, that occurs as the performance of a worker's duties. The following are scenarios that would not be exposures as defined under the bloodborne pathogen standard: the cleanup of blood or OPIM, correctly using universal precautions, proper PPE, and engineered controls and workplace practices to avoid exposures. Good Samaritan acts, such as acts that are outside of an employee's job duties that still result in an employee being exposed to another person's bodily fluids, such as a housekeeper or custodial staff member performing CPR or assisting with a serious nosebleed. This incident must still be reported to security, the compliance officer, and human resources. Or getting cut by broken glass or stuck with a hypodermic needle that was not contaminated with blood or OPIM, but the item causing the injury now must be disposed of as a biohazard because they're contaminated with your blood. For copies of Atlantic Cape's Exposure Control Plan or if you have any questions or concerns about bloodborne pathogen exposures, scheduling an HBV vaccination, or any other health and safety issues, contact Mary Simpson, the Compliance Officer, E106 in the Mays Landing campus at 609-343-5112 or msimpson@atlantic.edu. To report an incident, exposure, or emergency, contact security at the Mays Landing campus at 609-343-5125, at the Atlantic City campus at 609-343-4841, or at the Cape May campus at 609-463-6390. Keep in mind, in the event of a life-threatening emergency, dial 911 first, then security. Thank you.